Quality of life versus quantity of life. When dealing with quality of life versus quantity of life, the most common thing would be end-of-life care. End-of-life care involves, most of the time, palliative care or hospice care. Palliative care and hospice care both focus on improving a patient's quality of life in their last days. However, the difference between the two is that quantity of life is making sure the patient is comfortable, happy, and that their end-of-life wishes are followed. When dealing with quantity of life, you are looking at the numbers, increasing the time the patient is alive. When increasing a patient's life in numbers, you can also cause increased pain and increased suffering. You can prolong life, but is that the best thing for the patient? What does the patient want? There are two types of treatment when dealing with end of life. Palliative care is an interdisciplinary care approach aimed at optimizing the quality of life and mitigating suffering among those with serious complex illnesses. The other is hospice care. Hospice is end-of-life care for a terminally ill patient with a short life expectancy, which could be hours, days, or even weeks. Patients in palliative care can even transition into hospice care as the illness progresses and they get closer to the end of life. In the nursing field, we're going to see ethical dilemmas that deal with both hospice and palliative care, focused on quantity and quality of life. If a patient has what is known as an advance directive, which is created by the patient, if they become terminally ill or critically ill or injured and are unable to tell their wishes, this paper can be very important. And every nurse should always ask the clients if they have an advance directive or would like to make an advance directive. The decisions on an advance directive can include life-saving measures such as CPR, intubation, life support, and other invasive procedures that can alter the client's quality of life and go against the patient's wishes if there is no advance directive in place. I've seen many ethical dilemmas in my career as a PTA and as a nursing student. I once had a client in end of life who was medically sick, and it was obvious that the patient most likely was going to suffer if forced to stay alive. However, they had no advance directive, so the choice was left to the next of kin. This family member wanted the patient to continue trying to get better through physical therapy. And as a therapist, this was so hard for me to watch because we were required to transfer this patient. And I remember a day when I was transferring her with the help of another therapist as she screamed with tears rolling down her face. I had to walk away because I felt I was harming the patient, even torturing them. Thankfully, after a couple days of talking with a social worker, the physical therapy department, and the nursing staff, the client's family member agreed to hospice care. A couple days later, the patient passed away, comfortably. When considering the quality of life, it can include multiple aspects, such as comfort, pain relief, spirituality, ethical background, religion, and how a patient views their quality of life. Quality of life, however, can include quantity of life because it does not always mean end-of-life care. It could be a patient with a chronic illness such as COPD or a TBI that is paralyzed requiring 24-hour care. It could even be a patient with an acute illness that will have a full recovery. However, as nurses, no matter what the ailment, it is our job to provide the patient with whatever is required to improve their quality of life. In quality of life versus quantity of life, it is really hard to see why quantity would even matter, because you don't want to make the patient worse. You don't want to put the patient through multiple surgeries, intubation, life support, things that are doing nothing more than increasing their suffering. Quality of life is about giving the patient comfort through pain medication, through sedatives, whatever it takes for them to be comfortable and happy. However, when you deal with family members, you may run into an ethical dilemma, because family members have a harder time letting go. They have a fear of loss. They have a fear of death. Therefore, they want to keep the patient alive. And we have to follow what the wishes are of the patient or their medical power of attorney. It is also our job to advocate for these patients. And if the patient is suffering, our job is to advocate, to talk to the doctors, to talk to the care team members, to talk to the family about what is best for the patient. As nurses, we took an oath of non-malfeasance. Do no harm. If you are trying to increase the patient's numbers of living, then how are you doing no harm if the patient isn't going to get better and we're only making their suffering longer? This is a really hard ethical dilemma to deal with. When thinking about a nurse's responsibility and the quality of life, the ANA standards should be a part of that care that is provided, because the ANA states that nurses are obliged to provide comprehensive and compassionate care, including recognizing when death is near and conveying that information to families. Nurses should be able to not only use critical thinking to provide quality of life, but it is also our responsibility to provide the family with information in regards to the client's care and health. A picture of health can be different through the eyes of anyone. Health to us is the absence of illness and disease. However, with a patient who has comorbidities, health may be the relief of symptoms to improve their quality of life. As nurses, we are here to care for the patient and put the patient's needs above all else. We are here to help the patient feel better, to help the patient be comfortable. And sometimes we even have to butt heads with the doctors. I mean, doctors are meant to bring life, to save lives, to heal ailments. So it's harder for a doctor to make the decision to let a patient die than it is for even a nurse. As nurses, we want the patient to be comfortable and happy. And if that means allowing them to die peacefully and comfortably, then that should be okay. We always need to put the patient's quality of life over all things, no matter what is wrong with the patient. Quality of life is one of the most important things there is. Even for me and you and my students that I have become friends with throughout this nursing program that I'm in, our quality of life is what makes us enjoy things, what makes us happy. So in conclusion, when working with patients in end-of-life care, the focus should be on the quality of life, not the quantity of life. I hope you enjoyed this presentation. If you have any questions, feel free to email me at kristenkrist@ucwv.edu.